My name is Rob Baltussen. I'm Associate Professor at Radboud University Nijmegen Medical Center, and I'm the Principal Investigator of the project Reaching the Poor in Ghana's National Health Insurance. I think Ghana is kind of a model country for many other African countries, but also beyond Africa even, because it has managed to implement a national health insurance within the course of 10 years. But there were a huge difference between the rich and the poor. The rich enrolled more than the poor in the health insurance. So the reason for doing this research program was basically how can we stimulate enrollment mainly among the poor. This is a graph I'd like to show you, and it basically reports on the data we collected in 2009 on the insurance status of people. So in 2009 you saw a less than 20% enrollment rate among the very poor and a much higher, more than 40% enrollment rate among the richer population categories. If you're not insured, it means you need to find the money to pay for your health services. It means borrowing money from family members. It means basically falling into poverty. When we went to the villages to find out the reasons for not enrollment, we basically found out many reasons, and the reasons differed by communities. And especially for the poor, there was a lack of trust in the management schemes. There was a lack of trust sometimes in the personnel of the health facilities. So we saw different barriers in different communities that give us reason to think, okay, we cannot have a single intervention to try to eliminate the barriers. We need to have something else in place, local solutions for local problems. When we realized we needed local solutions for local problems, we thought about how can we achieve this? How can we actually, within every community we work, try to find a good solution? And we then came up with the idea of multi-stakeholder problem-solving groups, which is a group of different stakeholders, including representatives from the hospital, representatives from the health insurance management, and representatives from the community. Together identify and also think about possible solutions to remove those barriers. So what we did was basically implementing the problem-solving groups in 15 communities, while we also identified 15 other communities where we didn't intervene. And this is important because you like to see what's happening to the communities over time, even if you do not intervene. So we were able to tease out the effect of the problem-solving groups in terms of enrollment in health insurance, in terms of utilization of health services, and in terms of poverty reduction. We saw quite an impact of the problem-solving groups in the community where we implemented the groups. Enrollment in insurance went up from 34% to 41%, which is an increase of more than 20% over baseline. So it showed that problem-solving groups are indeed an effective way to improve enrollment. Secondly, we've shown in this research that once insured, people are less likely to fall into poverty. And that's big news. And that means that more investments in Ghana, but maybe also in other countries, should be geared towards implementing health insurance. When I got involved in this research in Ghana, I always said to myself, I want to have the intention, but not the pretension, to make a change to people's life in Ghana. I think this project has been quite successful, and we managed to maybe make that tiny change in terms of how people perceive health insurance and on how barriers can overcome by giving the community a voice. And I think as a research team we can be quite proud of that.